Hello, this is Dr. Matthew O'Brien. I'm not a medical doctor. I have a PhD in applied math, and I'm going to talk about some of the data analysis about the coronavirus to see if we can make some predictions or understand what's going on and what may happen and how difficult it is to predict. So I want to talk about how you can use the number of deaths due to the coronavirus to estimate the number of coronavirus cases. So to know the number of cases is difficult because it requires testing, and you don't necessarily test everyone, and you don't necessarily know how many cases you have. You just know how many have been tested positive for it. But you have a better handle on the number of deaths due to the coronavirus. Those are pretty well accounted for. And so if you know the mortality rate, say you have a 1% chance of dying and one person died, well, that means that 100 people had to have had the disease. And then if you know it's doubling time and how long it takes before you contract the disease to die, then you can estimate how many people probably have the disease using that. So that's an interesting estimation method. And then I'm going to talk a little bit about curve fitting. One of the persons on my YouTube channel mentioned the Gompertz function, which is another kind of like one of these sigmoid functions that asymptotes to a fixed value. And compare that with the logistic function. But both of them are curve fitting. They're not really predictive, especially when you're in the early exponential part of the data. And we also have some good news. In the USA, for the first time, the number of new daily coronavirus cases went down. So that's very good. So New York has finally started to slow down. And so now let's look at some data. So here's a plot of the number of daily cases. This is the day in March, so we have data out to March 21st. The black is the data. So for the first time, this last point actually went down less than the previous day, which is really good. So then we have two estimates, a low estimate in green and a high estimate in red of the actual number of cases based on deaths. So if you look at the number of people that died each of these days, it's backing out, well, if that many people died, how many people have it? So the black is what we know that have been tested, but these are saying, well, maybe that many cases are out there because we've had so many deaths. It's kind of saying we've had that many cases. But that also depends on these parameters. Let me show you what parameters it depends on. So here's the formula. The number of cases, this is what we're trying to predict in terms of the number of deaths. This is the input, and these other three things are parameters. How many people are going to die? Well, if your healthcare system is kind of working and you can take care of people, the low end is like 0.5. If your healthcare system is overcrowded and you can't take care of people, it's more like 4%. And we've seen both of these cases depending on the country and how jammed up their healthcare system is. And then the daily growth factor, what is the multiplication factor each day? This is saying 5% growth. This is saying 20% growth. And then this death time, this is saying how long before somebody contracts the disease until they die. So this is an estimate. On average, maybe it takes 17 and a half days. And so basically, the way you think about this, if one person died and there's a 1% death rate, that means there had to be 100 people that had the disease. And then this is accounting for the time shift. Well, they died, but they got it 17 days earlier. So 17 days ago, 100 people had it, and then you evolve that in time, and then you get this exponential part. Okay, now let's look at some curve fitting. So this top row is for China. This is the cumulative number of cases. The black dots are data, and then the blue and red curves. The red is a logistic curve fit, and the blue is a Gompertz fit. And then this right-hand thing is the number of daily cases. And here's for South Korea. Again, black is the data, red is the logistic curve fit, and blue is the Gompertz fit. This is the cumulative number of cases, and these are the daily number of cases. Now note, China and South Korea are really the only two countries that we can do this for because they've saturated. They're not getting more cases each day. All the other countries are pretty much in the exponential regime, so this model isn't really valid. Like for the U.S., okay, here's for Italy, for example. This is basically totally bogus, but you can curve fit data and just look at what you get. If you fit the Gompertz function, it's saying, what is this? 1 million cases are going to be in Italy. But again, it's still, look at the data. It's still in the exponential regime where it's still rising. So we don't have much faith in this prediction at all. My friend from Colombia sent me the data on the total number of cases in Colombia. These are the black dots here. They're only sort of like 12 days into it. This 12 here is, I guess, March 20th. They've only had cases for 12 days, but and then here's an exponential fit. So here the exponential fit, the base of the exponent is a 26% daily growth. So please, guys, stay at home in Colombia. You're still really, really early. You're having 26% daily growth. It's gonna get out of control if you guys leave your house. So Colombia and Raul, I don't know what position you have, Raul, but please advise them to tell people to stay home. That's pretty much the message for all of the countries in the exponential regime, with the exception of South Korea and China. That's pretty much every country. Some of the other Asian countries also have it under control, but so much of the Western world, Europe, America, South America, we're in the exponential regime, and things are not looking good. Italy, the Italy data, they're at 16% daily growth right here. This is a plot of the cumulative number of cases in Italy along with an exponential fit, and they're still at 16% daily growth. I hope things get better there. And here's a plot of lots of countries, maybe the top 10 or 20 countries. I put them on a log scale. It's showing, they're all in the exponential regime where things are growing at 20% per day-ish, give or take. The slope of this line is the growth rate, and they're all sort of have the same slope. So in the video description, I put some pretty good links. There's a great article by Tomas, Pueyo on the coronavirus, why you must act now. He wrote that on March 10th. Pretty early, pretty insightful. He saw this thing coming. And there's a cool video from the Khan Academy that does a better job explaining how you can predict the number of cases from the number of deaths. They explained the formula, and then I actually implemented it to look at a bunch of countries and look at it for the U.S. So things may be worse than we know, given the number of deaths in the U.S. And all my data is coming from this Worldometers thing website. I've got a link there. They're giving the time history of most of the countries. They did not have Colombia. That was provided by my friend Raul. And I'm gonna keep studying this thing, keep trying to analyze it. It's a very difficult problem, and it's not going away. The best thing to do is social distancing. You got to stay away from people. We have to contain it and not saturate the healthcare system. That's what keeps people alive. Is the worst people need to be able to go to the hospital for it. So we got to slow this thing down. Okay, thanks guys. Bye.